Hi there, and welcome back to the Dutch Podcast. I'm Dr. Jacqueline Smeaton, and on this podcast, we dive into the vast and ever-evolving world of hormones as part of our lifelong pursuit of better health. Here at Dutch, we've dedicated over a decade to transforming lives by addressing hormonal imbalances like cycle irregularities, perimenopause, menopause, and more. Our mission is clear: to simplify and advance hormonal health for everyone. On this podcast, I get to bring you cutting-edge insights from our top experts on hormone therapy, menopause, personalized medicine, and more. We're all aimed at making a real difference in your well-being. Your questions and feedback are crucial. They shape our discussions and help us navigate the complexities of hormone health together. Now, as always, please remember the content of this podcast is for educational and informational purposes only, should not be considered medical advice. Be sure to consult your healthcare provider for medical advice, diagnosis, and treatment. Hi, everybody. Welcome back. I'm so glad that you've joined us today. And I'm about to kick off our final interview of today. So thanks for joining us. We're at A4M Longevity Fest here at the Venetian in Las Vegas. And it's been a really packed day full of information about healthcare and longevity and hormones and the microbiome. We've had the chance to cover a lot. Now, I'm really excited for my last interview today with Dr. Julie Greenberg. Dr. Greenberg is really an innovator in her field, and she utilizes a Dutch test and a lot of other innovative methods to evaluate something that you might not think first about when you think about hormones, which is skin health. Julie's a specialist in integrative dermatology and really, in my opinion, has been a game changer in the patterns that she's noticed and the way she's innovated and the visuals. I mean, we should include some before and after photos in the show notes because you'd be completely blown away when you see the types of results that she's getting. So Dr. Greenberg is a licensed naturopathic doctor, and she's a registered herbalist, and she's been specializing in functional dermatology for years. She is the founder of the Center for Integrative and Naturopathic Dermatology, where she helps patients address real root causes of skin and hair issues. Dr. Greenberg also runs rootcausedermatology.com, which is a site that trains practitioners in a unique approach to dermatological care. I'll make sure we include those links because if you're a provider and listening today, you're going to want to follow up on this. She's got degrees from Northwestern, Stanford, and Bastyr University. She's currently co-authoring a book on psoriasis set to be released next year, 2025. Congratulations. Yeah. And Dr. Greenberg also teaches dermatology at naturopathic medical schools and is a sought-after speaker all over the world. So Dr. Greenberg, thank you so much for making time to talk with me today.
Thanks so much for having me. I always love chatting with you.
Same here. So I wanted to start by giving people an overview of your perspective on the skin. And, it's really interesting because in naturopathic school, when I was there, I won't say how many years ago, but it's now decades with an S on the end. You learn about the skin being the window to internal health. And it's the same thing that we learned about this like leaky gut. There were all these philosophies that came down from our teachers from even decades before we were students. But now we have the science to kind of back up what was observed from these providers a long time ago. So share a little bit about that perspective of like the skin being a window to health and how that applies to what you're doing with patients today.
Yeah, it really is. And yet I think, that even functional medicine practitioners make the mistake of when they think of the skin, it's like, okay, they either think of putting something on topically or with certain diseases like eczema or acne or psoriasis, okay, let's focus on the food. They're eating something and that's what's causing the skin breakout. And if we can just find that food and eliminate it, then we can fix that, skin problem. And really, we've forgotten about that very deep connection between the skin and the gut. And if you think about it, we're a tube, right? Where the outside of the tube is our skin, the inside of the tube is our digestive tract, and it meets in two places, our mouth and anus. And it's similar tissue. But again, still at the naturopathic schools and still, I think everywhere, we're really not teaching and fully connecting what's happening inside the gut with what's being represented on the skin. And that's really my focus. And, even when I started running the labs and using the treatments, as I was talking to different people in the functional medicine community, they kept thinking, well, the skin, you're just doing things on top of the skin. And I had to keep explaining, no, I'm doing gut microbiome testing. I'm doing hormone testing. I'm looking at the inside of what's happening to get to the root cause of what's happening on the outside of the skin. And it's everything. You can't really clean up the root causes of dermatologic disease or even skin aging just by going from the outside in. You need a dual-pronged approach, inside out, outside in.
I love that you're bringing that up, and I love that you raised the topic of food allergies. So I want to really start there because it's a very commonly taught perspective that food is at the root cause of skin conditions. Like eczema is probably the classic one. And I've actually, seen when I was in practice, like kids with really terrible eczema. We know that probiotics can help babies, right, with diaper rash, eczema, etc. But I took a food first approach. I sometimes got success and I sometimes didn't get success. And also the food first approach probably changed the microbiome for a lot of these kids as well who were eating like overly processed foods. But tell us what you see, because I was so fascinated. I heard you speak at NHAND, New Hampshire Association of Naturopathic Doctors, last month.
Yeah.
And you shared some of the data of what is out there around the relationship of food allergies and some common skin conditions. And I think it would surprise a lot of our listeners to hear the results. And I know I'm putting you on the spot. You might not know the exact numbers, but share with us the trends that they've seen.
Yeah. So, I mean, the first thing is, yes, you said, you get results sometimes going food first. And that is what I tell practitioners. Does food impact things like eczema and acne and psoriasis? Of course, right? There's going to be a relationship with food. And for some of your patients, a very small amount, maybe just dealing with food elimination or sensitivities will clean it up. But it's a small amount. So that's what I tell practitioners. Don't get stuck in the food bucket. If it's not clearing your patient, you're going to have to move on from there. And I teach all about, what different foods and different diseases and which ones to kind of look out for and maybe eliminate first that are the more likely suspects that are, plaguing your acne patient versus your eczema or psoriasis patient. But specifically to speak to the eczema data that you're talking about, I think a lot of us assume that the food allergy or sensitivity is driving the eczema. And what we've learned is that it's the inverse relationship. It's that the eczema is driving the food allergies and asthma, which is just an environmental allergy. And that's really mind-blowing to a lot of people when we first think about it. Like, how in the world could eczema be causing food allergies? How could it be that inverse relationship? But it goes back even to the concept of a leaky gut. I think most people now know this concept of a leaky gut, that with the gut, we need to have some permeability. We need to digest nutrients and stuff, but we don't want hyperpermeability. We don't want things leaking into the bloodstream from the gut. We want a good barrier going on in the gut. And it's the same thing for the skin. The skin obviously is the barrier to the outside world. And some things get into the skin that we put on, will absorb some things, and some things get out, like sweat and toxins. But we want to have a good skin barrier. And what we want that skin barrier to keep out is things like allergens. So pollen from the environment, dust mites from your home, dog dander from your pet, and cat dander, food proteins. And this is the crux of how eczema causes food allergies. Because when we look at infants and neonatal skin, if there's barrier disruption at birth, it's going to predict food allergies by the age of 2. Because what's happening is that little newborn has not seen pollen or dog dander or food proteins before. Their system has never seen it. And if the first introduction to the body is through leaky skin, it's the same concept of as leaky gut, where proteins of these environmental pollens or foods are getting through and getting presented to the immune system in that way first, the body will freak out over it, because we're not supposed to have dog dander getting through the skin and getting down into the epidermal layer, getting presented to the dendritic cells, which are the ones that are the information passing cells that tells our immune system if something bad got through. And that little neonatal, infant body doesn't know that dog dander is not really that big a deal, or that pollen or a food protein isn't that big a deal. But once that's the first introduction, it will trigger and set off allergies and asthma. And those can be deadly. And about a third of kids with early onset eczema are going to progress through what we call the atopic march, the allergic march. They're going to go on to get food allergies and asthma. And again, as we talked about, it is life-threatening to develop those diseases. So taking care of the skin, taking care of eczema, especially in these infants and kids at an early age, is really critical. And potentially life-saving.
Thank you for covering that so thoroughly. I mean, I think it's a really important piece because it opens up the next question, which is, if it's not a food allergy causing the skin problem, what is it? And I think that's an area where, again, I think you've really pushed the needle with tying together what you've observed in your practice, because no one's really looked at it that way until you came along. And I know now you see a lot of patients and you're doing this gut microbiome testing. So talk us through a little bit about how you manage patients with skin conditions. What types of tests are you looking at? You mentioned gut microbiome, you mentioned hormonal. And then I would love to dive into some of the common patterns that you see.
Yeah. So I'm exclusively derm. I only see patients with dermatologic complaints, and everybody has to do the GI map stool test and then an oat organic acid test for the first visit. So I'm looking at the gut microbiome at 100% of my patients, because fundamentally we know that, the gut is responsible for our immune system, a large portion of it. And when there's gut microbiome dysfunction, and that can either be there's not enough of the good guys to keep things nice and calm, and then the mucosal layer intact to prevent leaky gut, or too many overgrowth of pathogenic or unwanted organisms, we're going to ramp up the immune system. And that increased immune system is going to drive all of these chronic dermatologic diseases. I think somehow we think of skin diseases as not being chronic inflammatory diseases, but they really are. And again, I think we know, okay, the gut is the source of the immune system, but we forgot to make that connection when it came to skin diseases. And that's where I focus and do those tests on everybody. And then, as we talked about, I do the Dutch on a lot of patients. Obviously, for things like acne, it can be really helpful. But there's something called TSW, topical steroid withdrawal syndrome, which can happen to particularly eczema patients or anybody who's using a lot of even topical steroids. Mm-hmm. Their adrenal glands can really be off. So I find the Dutch particularly helpful to look at their adrenal stuff. I also deal with a lot of mold and mycotoxins. So I may go do like mycotoxin testing. So it's a very naturopathic approach. I think it's a holistic approach to the person to treat those derm conditions. I have to look at everything that's inflaming their immune system and setting things off. And that can be gut, hormone, or environmental toxins.
And tell us some of the associations that you've seen. Like we have so many kind of common skin conditions, but I know you see a lot of eczema, a lot of psoriasis. And I know you've noticed patterns of even infectious organisms that tend to align with different skin manifestations. So what are the things you see most commonly?
Yeah. So having done, thousands of these gut microbiome tests on patients, there's definitely like a pattern I tend to see for eczema patients. So there's the not enough and too much pattern. The not enough, my eczema patients have a leaky gut. And for me, how I determine that in the stool test is there's either no or low Akkermansia muciniphila. And I know you talked to Colleen Cutliff earlier on a podcast all about Akkermansia. So the listeners are interested in really deep diving into Akkermansia, go listen to that podcast. But the gist is that, Akkermansia muciniphila is a commensal organism that helps maintain that gut mucosal barrier and prevent leaky gut. So low or no Akkermansia muciniphila, low or no Faecalibacterium prausnitzii, and Roseburia, which are butyrate producers. And butyrate, Colleen probably talked about as well. Maybe
we didn't talk about butyrate.
Oh, okay.
So dive into that for sure.
So butyrate is a short chain fatty acid. And it's part of the reason why, if we stop and think about it, like we have 3 to 5 pounds of microbes, predominantly bacteria in our gut. I mean, that's mind blowing to me. That's like a hand weight we're carrying around and feeding everywhere we go.
Yeah, I never really thought about just how much that is.
It's a lot, and you step on the scale, think, okay, 3 to 5 pounds of that is
that's measurable.
Microbes.
Yeah.
But why we do this is that we have this commensal relationship. So with the butyrate producers like Faecalibacterium prausnitzii, we eat fiber, they digest the fiber, and they make butyrate for us. And butyrate does many things for our gut. It feeds the enterocytes, the cells of our small intestine. It lowers inflammation. It enhances tight junctions to prevent leaky gut. So no or low Akkermansia, no or low Faecalibacterium prausnitzii, to me is an indicator that there is a leaky gut. And then I also see on the stool test low secretory IgA often. The secretory IgA is the immunoglobulin A, the immune system of the gut. And when there's a deficient mucosal barrier, we can't produce enough secretory IgA and we get a lot of inflammation. So those 3 lower no Akkermansia, Faecalibacterium, and secretory IgA are kind of my leaky gut picture. And I see that very commonly on eczema. Everybody from my pediatric to my adult patients will show up with that. And then the overgrowth gut for my eczema patients tends to be Candida, Staph aureus, and Streptococcus. So those are kind of the two things. I'll also sometimes see a kind of subset of eczema that's got some H. pylori and maybe some protozoa. But that's the predominant one. My acne gut is pretty different. Well, different in a way. I don't tend to see the leaky gut so much in acne, but I see H. pylori, I see protozoa, and I see Candida. So it's a really different picture. And I'm to the point where a lot of times if I'm like looking at labs, I can guess at what is going on with the person.
I was going to ask you that. You probably like see the results and you know what the patient's chief complaint will be before they even come in your door.
Yeah, we do that game, and I teach the root cause dermatology course you mentioned, and I as students bring case studies, and sometimes I'll say, don't tell me what it is. Let me look at the labs and guess what your patient has. And usually I can get it. So
it's really amazing.
Yeah.
And I think, like I said, I think this is like an innovation that really can change the game in dermatology. Tell me a little bit about the receptivity of dermatologists, because I know you're training a lot now. And when you think about that topical, outside in approach versus this inside out approach, it's curative when you fix this. It's not a lifetime of management of increasing intensity of steroid creams or oral steroids or immune suppressive medications. These really hard hitting medications that are used in conditions like psoriasis, for example. It's a game changer. How receptive has the dermatological community been to learning this kind of new approach?
I mean, I think overall, generally, the dermatologic community within our, conventional medicine system is pretty conservative. So, generally, we're not seeing dermatologists overrunning functional medicine conferences like A4M.
They were.
Yes. But there definitely is a subset, and many, many, many dermatologists, board certified MD dermatologists have taken my root cause dermatology course, because there's a subset of dermatologists who are so frustrated with the system. And they're basically, the same as, I think all practitioners who were conventionally trained and have come over to functional medicine, they are tired of prescribing these very harsh suppressive medications, but not really fixing anything. And then that medication, as we talked about, like with TSW, can cause more bigger problems than the initial problem that the medicine was treating. So that there is a subset who are exploring, turning to functional medicine. Part of it is driven by patients. Patients are really tired, like in eczema, they are tired of being handed topical steroids. And it's really common when a new patient comes to me to say, I've been to 7 dermatologists and they all keep handing me tubes of steroids to put on me or my child. And there's nothing else that they're offering. And so I think that it's also patients pushing dermatology forward because they realize that patients are demanding this and that at some point they're gonna need to figure this out and get on board with it. But I think it's going to take some time before dermatology in general gets there, because it is a fairly conservative branch.
Yeah, and of course it would be a complete change of standard of care.
Right now, it's algorithmic based. And so at standard dermatologists, taking insurance can see anywhere from 20 to 40 patients a day. We know in that model, you don't have time to sit down, ask questions, get to know an individual. You don't have time to get to the root cause. You have time to very quickly write a prescription and an algorithmic, basis, like up to date, and then move on. And so the whole model has to change in order for it to support this kind of root cause medicine. But a lot of them are opting out of that, insurance, seeing 40 patients a day model, because it's not working for them. It's not working for patients. And it's not fixing anything. And we keep developing new, stronger drugs to suppress the immune system. It's all immune based, whether it's a steroid or Dupixent now in eczema is approved down to 6-month-old babies. We are injecting with a Th2 suppressant. And, same with psoriasis, they're all biologic drugs. And now the JAK inhibitors, the JAK-STAT pathway worries me with suppression, because it is such a wide mechanism, right? It's entry into the cell and DNA transcription. And I think as we get, 15 years down the line, we're going to see a lot of problems, a lot of side effects with the JAK-STAT inhibitors. So partially, I think it's patients who are moving forward dermatology into the, advanced model where we can fix these problems, but it does take time. It's not a 5-minute visit and a quick prescription.
Yeah, I know that you are working primarily with people with skin disease. They're coming into you, but what about when we look at people who are really looking at skin optimization? And I'm thinking about, we have this A4M crowd, we're in the expo hall, we're full of opportunities to put things on your skin, whether it's red light therapy or whether it's creams or serums. What about microbiome? Are we looking at that from an optimization and kind of anti-aging perspective as well? Is there a place for this approach there?
Yeah, 100%. I think whether you're looking at curing a chronic dermatologic disease or optimizing skin health, it's the same thing that we talked about. There is an outside-in approach where red light therapy, things like that can be helpful, but that inside-out and establishing, gut microbiome health, that absolutely is going to keep the skin looking younger. You're going to have less wrinkles, and so we are a culture that is looking for procedures and topicals. But I always try to remind my patients, all this work that you're doing, it's going to enhance your skin as well. Taking sugar or reducing sugar out of the diet is one of the main things that we can do. It attaches to the collagen proteins in our skin. And instead of having nice, supple, flexible collagen, which we want, because that, we talk about wrinkles. What is a wrinkle? It's collapsed collagen and elastin. The sugars attach to the collagen proteins and make like crunchy collagen, and that is going to lead to wrinkles. We want nice, supple collagen. Collagen supplementation can also be beneficial, and lowering that inflammation, correcting the gut microbiome dysbiosis is 100% going to help with natural anti-aging and healthy, youthful looking skin. It is a reflection of what's happening inside, 100%.
Yeah, I even think about like redness and the ability of the skin to heal itself from like discoloration or, sun exposure. And
yeah, even UV protection, right? The things that we're eating. So green tea and foods rich in lycopene, that enhances UV protection, and UV damage causes aging. So the healthier the foods you eat high in these polyphenols, that is skin protective against sun damage. I mean, it all goes together. All of the concepts of health in functional medicine, everything we're talking about in depth here at A4M that we're doing internally for health, it's naturally anti-aging without having to spend for procedures or, inject or do anything like that.
Yeah. And it would be great if we had that philosophy come first. And then if you want to apply other, different processes, procedures, etc., go for it.
Yeah.
But I think covering these foundational basics is critical and something that we often miss. It's not a big part of the conversation to work on the gut, even in aesthetics practices, where it seems as though that's a really big opportunity for aesthetics practices to really impact patients positively.
Yeah. And I think part of it is financial. When you go into a dermatologist or an esthetician, they're going to make a lot more money off of you doing procedures than counseling you to, reduce sugar and alcohol and get polyphenols into your diet. So there's an incentive to sell people things. But with all those procedures and all of those topicals, I think there's a limit as to how much you can do. And then there's a certain point where I think, it's obvious that someone has done a lot of procedures to their skin, and instead of looking better, it starts looking kind of artificial. Everything we're talking about, it's natural, it's beautiful, it's the internal health shining through, and you're going to always look better with these things, always.
Yeah, fabulous. So I want to shift gears a little bit and talk a little bit about the intersection between the gut microbiome and hormonal health. As a Dutch, of course, we love to talk about hormones, and there's so much information coming out around the role that hormones play in modulating the microbiome, and then the role the microbiome plays in modulating hormones. So tell us a little bit about these concepts and how you see this play out in your practice.
Yeah, 100%. I mean, we know that the body is connected. And so I see it, in doing the hormone labs, and I don't use, I don't do HRT. So I'm not prescribing, estrogen or testosterone or anything off of the labs, but I am fixing the gut. And then a lot of times by fixing the gut, we do see the hormones right themselves. Or I can use supplements, like if somebody's high in testosterone and that 5-alpha DHT pathway is high on the Dutch. There's great herbs like the 5-alpha reductase inhibitors, things like saw palmetto, pygeum, nettle. I can use it, temporarily to kind of try to inhibit that pathway, reduce the acne while we're fixing the gut. And then, as you said, like that gut hormone connection, fixing the gut, the hormones are going to right themselves. Because we always all do want to understand, like, why are the hormones off, or why is the cortisol high? And there's 100% a connection between the hormones and what's happening in the gut, for sure.
Yeah, and I actually should pull the study because I can't remember the strain off the top of my head, but we think about estrogen metabolism a lot when we think about the gut, because there's strains that increase beta-glucuronidase, which increases resorption of estrogen metabolites. And we do see in our lab when indican is high in urine, which is a general marker for dysbiosis. It's not specific, but it's general marker. We see higher estrogen levels in those patients, and we look at them as a broad group.
Yeah.
So we do see that play out. But there's also strains that have been identified that modulate androgen metabolism. And I don't have that on the top of my head, but I'll pull that study and share it with you.
Yeah, I would love to see that.
Yeah, because I think it's probably very relevant when you're looking at acne patients as well, when testosterone or androgens are a piece of that picture.
And that's a good point about using the test interconnectedly. So yes, when I see that the beta-glucuronidase, is really high on like the GI map, and then I can go do the Dutch and see how it's impacting the estrogen. But a lot of times, like you said, that high beta-glucuronidase is due to the kind of dysbiotic bacterial strains. And when I can use something like a calcium D-glucarate, again, temporarily to kind of, manage that process. But if we clean that up, then the estrogen is going to go back to normal. And then with the oat, there's glutathione markers and, looking at the 4-OH pathway for estrogen metabolism. All right, if the glutathione's off, we might see that 4-OH pathway is high. And so again, it's all connected, what's happening in the gut and what's happening with the hormones.
Fabulous. So my kind of final area I really want to talk to you about is we have so much in our skincare world going on right now. And there's all these special ingredients and special nutrients. But when you're thinking about it from a naturopathic point of view, what are the core foundational elements of like a good holistic skincare regime? So I'm sure you talk about this with your patients too, because it is what you put on and what's going on inside.
Yes, I do. So there's some simple principles. One is read the labels. I think most people who are interested in anti-aging and health, we're already really like on top of our foods, right? We read the labels. If we pick something up in the market or we're eating at the restaurants we know are healthier, not like the fast food places. And we know that there's a big difference between a hamburger that's 100% grass-fed, grass-finished meat that's not like charred and blackened, right? That meat can be very helpful for us with avocado, and it can be like a wonderful meal that's healthy versus a fast food burger that's actually, contributing to aging and death. Mm-hmm. And so we understand our food source, we read the labels, and we're trying to put things in our body that have few ingredients in the list, that aren't full of chemicals. So our body understands it's that whole food idea with food. And it's the same principle applies to skincare. I tell my patients, read the labels of your skincare products and look at them with an eye like you're consuming, foods. If it's got a long list of multisyllabic chemical sounding things, it's the same as eating something like that. Our skin doesn't know what it is. And as we talked about, we absorb things from our skin. We absorb it into our bloodstream. And so there are so many chemicals in products, personal care products, makeup. The average woman now can put up to 500 chemicals on her skin a day. It's astounding.
That's unbelievable. And I know like with African-American women, that number is even higher.
It can be, yes. And our children were putting all these chemicals on too. And so reading the labels is the first thing. If you see a long list of these chemicals, you don't know what the chemical names are, and there's a lot of them, it is probably not something you should be putting on your skin because you don't want to absorb those. And whether it's a soap or a moisturizer or whatever the product is, just like food, you can have, a pizza that's flour, water, egg, tomato, and cheese. Or you can get a pizza out of the frozen section that's got like a list of 20 chemicals The same thing with your personal care products. And it doesn't matter what the personal care product is. So that's the first thing, is reading the labels. There is a database from the Environmental Working Group called the Skin Deep Database that can help people if they're just getting started. You can key in a manufacturer and a product, and it kind of rates the product overall on a safety scale. And then you can also look up individual ingredients. And sometimes when people are starting out, that's helpful for them, just because we don't know what these chemicals are. Then there's certain kind of principles. So the skin is supposed to be acidic, and most people don't realize that. So there's the pH scale, and keeping the skin acidic is anti-aging, because we've found that skin that is acidic ages slower. So if you are putting products on that are going to raise the pH of the skin, make it neutral or alkaline, you're going to get more wrinkles and you're going to age quicker. Yeah.
So what are some of the things that push it to be more alkaline, or what, or alternately, what keeps it acidic?
Yeah. So some good cheap acidic things that you can do that's great for skin: apple cider vinegar. You don't want to put it on neat, so you're not going to just put it on direct, because that'll be pretty stingy. But you can dilute it with water, like 50-50. If people don't like the smell of apple cider vinegar, hydrosols are a fantastic option. So hydrosols are made as a byproduct of the essential oil making process. So if we take something like lavender essential oil, which I think we've all heard of, the way that it's made is they take like hundreds of pounds of lavender plant with water in a copper distiller, and they heat it up, and then what evaporates is collected in a cooling still. And that top layer are the volatile oils. That's the essential oil. Those we don't want to put directly on the skin, because they're very powerful, and there can be all sorts of problems with putting essential oils directly on the skin neat. But the water that's left underneath it is the hydrosol, and it's almost like a tea. Yeah. It's very gentle. You can use it on infants and pets, and it's totally safe. And those smell great. So using a hydrosol after a soap is a great way to acidify skin with a nice smell if people don't like apple cider vinegar. And aloe vera gel is also acidic, and it enhances collagen. So let's look at a nice, simple 3-step routine that somebody might use for anti-aging. First is finding a natural soap. Again, read the ingredients. Soap is a chemical reaction between lye and a fat. So you're going to see something like sodium hydroxide, which is the lye, and then some sort of natural fat. It can be like a beef tallow, it can be coconut oil, or, you know, any sort of plant oil. That's what you would want to see. And then just a couple of things. We don't need a lot of chemicals in the soap. So simple ingredient soap, then use that baby hydrosol, and then we want a moisturizer. And one of the easiest things to get a healthy plan in place for a moisturizer is to use oil serums. So we've somehow become really dependent on these creamy lotion moisturizers. But the problem is, what is a lotion? It is a oil and water emulsion. And I think we all learned in 5th grade science class, what happens when you pour oil and water together?
They separate.
Yeah, they don't mix. So how are we getting this creamy thing? Chemicals. We need chemical emulsifiers at the molecular level to smash them together. And now that we have water in a product, we need preservatives. So if you look at something like the Environmental Working Group and you look up like a moisturizer, a lot of the products that are going to list as not being healthy are going to be the emulsifiers and the preservatives. Well, if we separate our water-based products from our oil-based products, we don't need emulsifiers and we don't need chemicals. So right there, you've alleviated so much of the chemical burden of those 500 chemicals, right? We've taken out a lot of them. So I like oil serums for the face. There's certain oils we want to use on the face that won't break you out. Things like jojoba oil or grapeseed oil. Don't use coconut oil on the face. That will cause acne. And as long as you have somebody who's blending properly, essential oils within the carrier oils, so within those like argan oil or jojoba or grapeseed oil, are wonderful anti-agers. And that's a great 3-step plan. You know, a nice natural soap, something to acidify the skin like a hydrosol, and an oil-based face serum with some essential oils.
You make it seem so simple.
It is. It's that simple.
And it's amazing to think about, you know, all the additives, and some of the preservatives can be antioxidants, like rosemary oil as an example that you might see that I love that you add. But
the essential oils are
helpful too. I'm really appreciative for the simplification of it from
like
someone
food.
who sees skin all the time.
The simpler, the better. It's just like food.
It's like Whole Foods nutrition for the face.
That's exactly what it is.
Yeah. Wonderful. Well, I've really enjoyed having you on. I really appreciate you coming on to share your expertise. And like I said, if you are interested in learning a different approach to skincare and dermatology, like I would absolutely recommend talking to Dr. Greenberg. Like I really believe that you are the innovator in this space. And I do hope to see that decades later, all dermatologists and family medicine docs are able to do what you're doing, because it's really getting at the root cause and preventing people from so much strain and pain and emotional distress that skin conditions can cause. So thanks for the work that you do. And thanks for joining us here today.
Thanks so much.
Yeah. Thank you guys very much. This ends our broadcast live from A4M Longevity Fest. If you're wanting to learn and really expand your expertise in hormones, you're not going to want to miss our podcast. So make sure you tune in each and every week for our new content.